X-ray of the part as for the other fracture, and in addition look for the missing pieces of the bone in open fracture is important. So X-ray has a one of the important thing in the fracture. Student join fast. So this is a diagram of a compound fracture of the femur showing a bone loss. So this is a compound fracture of the femur. In that case, there is a showing a bone loss. So in that, there is a bone loss in this part, hmm, in this image. So general investigation like HB blood group, BTCT, HIV, HBS, AG, urine routine, and X-ray is very important in the investigation of the compound fractures. So in that case, there is a loss of the bone, that there is a fragment fractures, and there is a no not seen a bone clearly. So there is a bone loss in the compound fracture. Then compound both bones fractures of the leg. So this is a X-ray of the fracture of the leg. It is very important in the viva, that is in the oral of the final, that reading of the X-ray. It is very important topic. So the compound of the bone fractures of the leg shows the fractures in this X-ray. In that case, there is a fracture of the one or two or the more bone with the loss of the soft tissue, tendons, muscle. So this is a type of the compound fracture of the leg. Then management principles. Aim of the treatment. So aim of the treatment is to convert a contaminated wound into the clean wound, and thus help to convert an open fracture into the closed wound. So firstly, the contaminated wound is converted into the clean wound, and help to convert open fracture into the closed one is important while treating the patient, and to establish the union in a good position. Then, to prevent a pyogenic and clostridial infection. Consideration is that first to stabilize general condition of the patient, as the patient is usually in shock. This consists of resuscitation, blood transfusion, and intravenous fluid, that is IV. Then antibiotics, oxygen administration is required. So, firstly, to generalize the patient's condition and to stabilize the general condition of the patient is required a resuscitation. BT, that is blood transfusion, IVF, that is intravenous fluid, antibiotics and oxygen administration is important in these cases. Then to keep the wound covered with a proper sterile bandage until the patient is ready for surgery. So until the patient is ready for surgery, our work is to keep the wound covered with a proper sterile bandage. Then, open fractures are surgical emergencies and surgery is to be done as soon as the patient is fit. So, open fractures is very important surgical emergency and surgery is to be done as soon as patient is fit. Then, treatment plan. It is a teamwork and involve a battery of specialists like the vascular surgeon, plastic surgeon, thoracic surgeon, general surgeon, facio-maxillary surgeon, and of course, the orthopedic surgeon is the most important. One of these specialists manages the injury to the vital organ and the general condition of the patient is stable. Then the fracture are dealt by the orthopedic surgeon. After stabilizing the general condition of the patient, the surgical debridement is planned under a strict aseptic measure in a major operation theatre. Then debridement. It is also known as the unbridling. So this is the most important step in the management of the compound fracture, that is debridement. It consists of the following steps, that is 4 E's. Firstly, exploration of the wound, then excision, excision of all non-viable structures is important to prevent infection. Then the recognition of non-viable tissue before excision is of paramount importance and the tissue are dealt with as follows. So exploration of the wound. Firstly, in the debridement, there is a firstly explore the wound. Then excision of non-viable structure to prevent the infection is also important. So technique of debridement is seen in this diagram. In that criteria to evaluate a tissue status, that if the tissue are pink color then they are viable and if they are pale then they are non-viable. Then consistency of a tissue is firm then these are viable tissue and when they are flabby consistency of the tissue then they are not viable. When capacity to bleed is preserved, they this is seen in the viable tissue status, and when capacity to bleed it is lost, then it is a non-viable tissue. Then circulation if present then it is seen in the viable tissue, and in the non-viable tissue status there is a circulation is absent. Contractibility of the tissue is present in the viable tissue status and contractility of the tissue is absent in the non-viable status. So it is seen when there is a debridement of the debridement done during the excision of the non-viable structures is important to prevent the infection. So this is the diagram of the debridement. Then third is the evacuation of the foreign body like dirt, glass, stone, pebbles, etc. So when fracture is present, then there is a foreign body invasion in the fracture. So evacuation of the foreign body, that is dirt, glass, stone, pebbles, that is removal of that is required in a case of the before the debridement of the fracture. Then about the irrigation. Dilution is the solution of pollution and single most essential step. Minimum 10 liter of saline is used in such a cases with the forcible streams are avoided. Then squeezing movement of the irrigation fluid is preferred. Irrigation or wound toilet help to clear foreign bodies and clot minimize the chances of the contamination. So when irrigation or wound toilet help to clear foreign bodies, so removal of the foreign bodies and clot also to minimize the chances of the contamination is required in the irrigation. So the aseptic additives kill the bacteria and detergent irrigation aim to remove then kill the bacteria. Then fourth, that is external fixation. So this is a diagram of the external fixator preferred a method of immobilization in the open fracture. So this is the external fixator and these are used to fix the fracture fragment after a debridement. Plaster of Paris, that is POP, an internal fixation device, have a little and controversial role in the fracture management of a compound fractures. External fixator help to stabilize a fracture fragment and allow a daily wound inspection and dressing. So it permits a procedure like a skin grafting to cover the wound, allow a soft tissue to heal apart from providing early mobilization, and in open fractures, external fixator can be safely exchanged to internal fixation within 3 weeks, with only 5% incidence of deep infection. So the external fixator, that is, this is called as the external fixator. It is used to fix the fracture segment after debridement. So the debridement, that is, this one is the first step. Then external fixator is used. So POP, that is plaster of Paris, and internal fixation device have little and controversial role in the fracture management of compound fracture. But external fixator has an important role. So it helps to stabilize the fracture fragment. So when there is a fracture of more than 2 to 3 bone, then there is a fragments of the fracture. So to stabilize that, external fixator is helpful and it allows a daily wound inspection and dressing. So permit a procedure like a skin grafting to cover the wound and it allows soft tissue to heal apart from providing early mobilization. So external fixator is important to skin grafting to cover the wound and in open tibial fracture, the external fixator can be safely exchanged to internal fixation within the 3 weeks or with only 5% incidence of deep infection. Then indications for external fixation in open fracture. So in the open fracture, indication of external fixation are when there is a grossly comminuted fracture or grossly contaminated wound, side swipe injuries, periarticular fractures, pelvic fracture, pylon fracture, tibial plateau fracture, and acetabular fracture. So these are the indications for external fixation in open fracture. Preferred method interblocking nailing is emerging as a better alternative than plating for external fixation in open fracture. Then, primary internal fixation in open fracture in that in the recent times this concept is undergoing sea change and the innovation regarding the primary internal fixation is a fast disappearing and the reason for this shift instance is improve the method of the wound care powerful antibiotics, improvement in the investigations and operative technique, improvement in the external fixation device, etc. So, primary internal fixation of the open fracture is necessary. Then, indication for internal fixation in open fracture are intra-articular fracture, multi-system injury, multiple fracture, elderly patient, head injury, vascular injury, and the tibial shaft fracture. So, in such a cases, internal fixation are useful in open fracture. Then, other form of the fractures, that is immobilization. Pins and plasters have limited use and can be tried in type 1 fracture. Limited internal fixation, that is in grade 1 and in some grade 2, grade 3C fracture, there is a limited internal fixation. Skeletal fracture. Overhead the olecranon traction for a compounded supracondylar fracture, Bowler's-Brown skeletal traction for open femoral shaft fracture is some of the examples. Then, plaster of Paris cast practically have no risk. Open fact in open fractures are after about fixation method in open fracture. External fixator that is liberally used, internal fixates that is sparingly used, skeletal traction is rarely used, plaster cast is occasionally used in type 1 and functional brace that never used. So these are the fixation method in open fractures. Then poetic fact. So the James poem depicts the four major principles of debridement. That is, on the edge of the skin, take a piece very thin. That is one. The tensor fascia, and the more you should slather, that is two. Of muscles, much more until you see a fresh gore, that is three. And the bundle contrast, at least these impact hardly any bone, only the bite quite alone, that is four. So, when there is a theme, this is the first one type of debridement. When the tensor fascia is involved, there is a two. When muscles and much more is involved, then there is a three. And the bundle contrasts at least the impact, and with the bone, then there is a four. So, in that case, mostly remember that problem peculiar to open fractures. In an open fracture, soft tissue injury is dreaded problem than the fracture itself. It is a surgical emergency, and there are three problems, that is infection from environment, problem of soft tissue loss, and active infection. So the effective immobilization rendered difficult and bone repair is delayed. Speed is the virtue in treatment, and infected non-union, malunion, chronic osteomyelitis are very common. So there is a difficulty in using the standard internal fixation method, rendered managing the fractures very difficult. So these are the points are remembered while we treat the open fracture. Then some interesting treatment guideline the world that over the open fracture, 17% surgeon culture a wound on adhesion. 98% give antibiotics after initial debridement and 97% use cephalosporin. So except in grade 1 debridement was done more than once, 14% surgeon discharge a patient with the oral antibiotics and reoperation was done in few cases. So the definitive wound care after resuscitation, debridement and application of external fixators, attention is now given to the definitive wound care. And this is an extremely important step as the primary object of the treatment in open fracture is to convert an open wound into the closed wound, and the wound closure could be primarily or secondary. So this is all about the wound care. So when the patient come with the wound and the fracture, so primary and secondary basis, what treatment we give to the patient. So this is all about that. Then a criteria for the primary closure. Now there is- So in the next lecture we will continue our lecture with the criteria for primary closure. Till that we stop here. So have a good day.